And a few certain things that are important to know when you're auscultating the patient's heart, we want to use the bell of our stethoscopes. So make sure that you know how to use that, because there are a variety of stethoscopes out there, and so you need to know how to use your stethoscopes to be able to access the bell of it. And then it is also very important to know the landmarks so that you then can assess for the landmarks in the correct locations. So first we have the sternum, the intercostal spaces, which is basically the space in between the ribs, intercostal, the clavicle, which is the collarbone, the mid-clavicular line, which is right at the center of the clavicle, and then you can just follow it down. And then also we have the mid-axillary line, which is the axilla, the armpit, and goes down in a straight line here.